Hi, this is Stacy Fouts with Clinical Informatics. Today we're going to talk about the nurse orders review. The concept of the 12 or 24-hour order chart check is greatly changed with computerized physician order entry or CPOE. The physician or mid-level provider directly enters the orders into the computer and the orders are sent to the correct department, eliminating the need for another person to transcribe the orders or enter them. Medication orders are immediately available in the MAR. Instead of a 12 or 24-hour chart check, this instead becomes the nurse review process. The process starts at bedside report, is continually reviewed throughout the shift, and ends with the next bedside report. All orders should be reviewed to ensure they are appropriate for the patient and have been carried out. For nurse review, one chart is designed for any new orders to be reviewed by the current shift and are available again to be viewed by the next shift. The yellow sunburst icon indicates new orders or results. The red sunburst icon indicates stat orders or critical results. Starting your shift. During bedside shift report, the oncoming nurse logs into Care Compass and along with the offgoing nurse quickly reviews the orders from the past shift. At the beginning of your shift, mark all orders as reviewed. This will clear the nurse review icons. Nurse review will then serve as a notification to you as the primary nurse whenever you have any new orders. Emphasis is placed on the nurse who marks the order as reviewed. It is stating that you acknowledge the order and you will be acting upon it. Selecting the nurse review stamps your name as the person who reviewed the order. This can be viewed in the order information history. This will only track the first nurse to mark the order as reviewed. If you mark the order as reviewed, you are taking responsibility for that order. Ensure that it is acted upon. You do have the option to uncheck an order if you would like to leave it in nurse review as a reminder for later. There are other order review processes that need to be done throughout the shift to ensure the chart check has been done. Let's talk about planned orders. Physicians have the ability to plan order sets. This means that these orders will remain in an inactive state until they are initiated. Some instances of when planned order sets are appropriate are when a patient is admitted from the ED. The admission orders may be planned while the patient is in the ED with the intent for them to be initiated when the patient arrives on the nursing unit. Those orders should immediately be initiated when the patient arrives on the unit. Another instance of appropriately planned orders would be when the patient goes to surgery and the post-op orders are planned either prior to or after surgery. Those orders should also be initiated immediately when the patient arrives on the unit. You do not need further communication to initiate these orders. You can review from Care Compass which of your patients have planned order sets in the Plan of Care section. The plan will be bold and will have the colored sunburst new order icon. You are able to select the planned order set from here to review the orders in the order screen. To initiate planned orders, right-click on the order and select Initiate, or select Initiate at the bottom of the screen. Select the communication type of Initiate Plan Conditional. There may be order sets that are inappropriately planned. Physicians may unintentionally plan orders instead of initiating them. For respiratory therapy planned orders, ask your respiratory therapist if that order set can be discontinued. If there is any confusion about which order sets to initiate, you should call to clarify. Cleaning up of orders. Each department has been asked to clean up order sets before the patient leaves their department, such as ED, pre-op, SPS. However, if this has not been done and there are active orders for another department, then the assigned nurse will need to do this. Examples would be anesthesia orders, pre-op orders, after surgery is completed, and ED orders. Right-click on the plan name and select to discontinue it. When you review orders, you may notice orders that need to be cleaned up or discontinued. One example is communication orders. These are equivalent to a free text order telling you to do something. This means that without intervention, nothing will be done. Communication orders must be reviewed and acted upon. For example, there may be a communication order instructing the nurse to call today's troponin. For one-time orders such as this, change the status of the order to complete when the communication has been done. Communication orders may also be used inappropriately by the provider. An example would be lab or diagnostic orders. If these orders are not correctly entered into one chart, the tests will not get done. If this happens, the nurse should enter the order correctly, complete the communication order, make sure to select cosign required when placing the correct order. Communication orders may be orders for tests not available in one chart. For example, an order for a test on a tissue sample would need to be transcribed on a downtime rec and sent to pathology. The order to change attending should be done in PM conversation. Once done, change the status of the order to complete. Any one-time patient care order should be changed to complete once they are done. Do not complete orders that are constant orders, have a PRN frequency or other frequency such as daily wait or ambulate TID. Also, do not complete orders for other departments. Other departments will complete their own orders. Lab and radiology orders will get automatically completed when done. PT, OT, dietary, social work departments will complete consults to their own departments. Cleanup of completed orders will help to make the all orders review quicker. Okay, at the end of your shift, at some point before bedside shift report begins, review all active orders in the order screen. You can change the filter in the order screen so that you can only see active orders. This removes all of the completed and discontinued orders for easier viewing of only active orders. Review all orders for appropriateness. Look for the glasses icon for orders that have not been reviewed. When you begin shift report, the oncoming nurse should log in. Review all orders from your shift with them as they clear the nurse review icons. Performing all of these steps ensures that a thorough 12 or 24-hour chart check has been completed.